Chapter 12, Standards. A standard is a scientifically based statement of expected behavior against which structures, processes, and outcomes can be measured. Because technology changes so quickly, standards should be technology neutral, meaning that they do not rely on any one type of technology in order to work. Standards must also be neutral to implement processes which vary widely and not prefer one vendor over others. Public-private partnerships are one way governance issues can be addressed and resolved. Public-private partnerships is a contractual arrangement between a public agency, whether it be federal, state, or local, and a private sector entity. Through agreement, skills and assets of each sector, both public and private, are shared in delivering a service or facility for use of the general public. Each party shares the risk and reward potential in the delivery of the service and/or facility. Standards development organizations, or SDOs, are private or government organizations that create or approve standards at the national or international level. Standards development organizations, or SDOs, are private or government organizations that create or approve standards at the national or international level. There are many SDOs for HIT and health information exchanges. Standards developed by different HIT and HIE organizations may overlap or compete with each other. Standards allow smooth exchange and incorporate data from all sites, vendors, and specialties across the healthcare continuum. Unfortunately, that sometimes leaves HCOs struggling with interoperability issues because standards overlap and can be interpreted differently by each stakeholder because they view the standard in a different context. The International Organization for Standardization, or ISO, is a large, widely recognized international SDO that has established many standards for EHR architecture and content. There are more than 22,000 standards for technology and manufacturing. It takes approximately 3 years for the ISO to review and approve a standard. Some general areas of standards for HIT include the following: vocabulary and terminology, which is a specific set of values for a specific data type; transport messaging, which is how information is sent and exchanged between systems; security, which provides assurances that messages are protected; content, which identifies what data elements are included, where they are located, data type, field length, and so on; and finally, technical, which usually is a formal document that establishes uniform engineering or technical criteria, methods, processes, and practices. The American National Standards Institute, or ANSI, ANSI, is the SDO for the United States and is a representative to the ISO. ANSI does not develop standards but provides a neutral environment for organizations and entities to work together to settle on a common agreement for standards for the format of content, requirements, and more. Before a standard can be approved, it must meet the rules of ANSI in the following requirements. 1. It must be made from consensus, which is how agreements are determined. 2. Due process, which are procedures and specific committees that perform the critique, review the proposed standard, and eventually approve the proposed standard. 3. Openness, which is transparency of all procedures to all parties. 4. Balance, a platform for standards development that withstands scrutiny while protecting the rights and interests of all members. The ISO has developed a six-step process for organizations that request approval for the specified standards. 1. Proposal. The stakeholders agree there is a need for a particular standard. 2. Preparatory. A draft of the proposed standard is submitted. 3. Committee. The draft is analyzed and revised by committee until consensus is reached. 4. Inquiry. The proposed standard is available for review and comment by all stakeholders. 5. Approval. The final draft is voted upon for approval. And 6. Publication. The standard is published. ASTM International is well known in other areas of industry, but its healthcare aspect is only in the US. The US division, the Committee E31, addresses standards for healthcare data management, privacy, confidentiality, and security, as well as data analysis and information capture and documentation to help practitioners preserve and transfer accurate patient information using EHR technologies. Data content standards are clear guidelines for the acceptable values for specified data fields. These standards make it possible to exchange health information using electronic networks. They identify the structure and content of data elements to be collected by the EHR. Data content standards allow organizations to collect data once and use it many times in many ways. They also assist in data storage and mining, as well as sharing data with external organizations for use in benchmarking and other purposes. The use of data content standards also assists in the health information exchange process. Health Level 7 International, or HL7, was founded in 1987 as a not-for-profit, ANSI-accredited SDO dedicated to providing a comprehensive framework and related standards for exchange, integration, sharing, and retrieval of electronic health information that supports clinical practice and the management, delivery, and evaluation of health services. HL7 has developed standards for the electronic exchange of clinical documents, such as the discharge summaries and progress notes, referred to as the Clinical Document Architecture, or CDA. CDA uses HL7 XML-based document markup standards for the electronic exchange model for the creation of clinical documents such as discharge summaries and progress notes. Implementation guides are included with each standard and define how to use the specific standard for specific purposes. The implementation guide removes optionality. It states what data elements are required and when, so that there is no room for interpretation. ASTM International created the Continuity of Care Record, or CCR, which identifies a core data set of patient information that must be passed on to the next healthcare provider in order to efficiently and effectively continue the patient's healthcare. The CCR was designed for all patient referrals and transfers. Core data set for the CCR contains the following: document identifying information, patient identifying information, insurance and financial information of the patient, patient's health status, care documentation and plan recommendations, advanced directives, list of healthcare providers involved in care of patient. The Continuity of Care Document, or CCD, is an implementation guide for sharing continuity of care record, or CCR, patient summary data. It is the result of the joint effort between the ASTM International and HL7. It fosters interoperability of clinical data by allowing physicians to send electronic medical information to other providers without loss of meaning and enabling improvement of patient care. Vocabulary standards is a list or collection of clinical words or phrases with their meanings, address the problem of multiple ways to define, classify, and represent language. Medicine has its own language. There are many terms used in medicine that have multiple synonyms. For example, the terms medical and therapeutic, curative and drug, and medication and pharmaceutical can be used relatively interchangeably. Several terms fall into the concept of vocabulary standards, including language, vocabulary, terminology, and nomenclature. Language is a system of communication used by a group of people. Vocabulary is all the terms that can be used for communication within the area of specialization. Terminology means the words used for a specific purpose. Nomenclature is a system used to assign names. Each term included in the vocabulary should have a unique meaning. Terminologies and vocabularies can have overlapping terms due to synonyms and eponyms. This is one of the challenging aspects of medicine and the application of EHR and diagnostic software to interpret unstructured and sometimes structured text from a physician or other healthcare provider. The systematized nomenclature of medicine clinical terms, or SNOMED, CT, is the most comprehensive, multilingual clinical healthcare terminology in the world. SNOMED CT contributes to the improvement of patient care by underpinning the development of EHRs that record clinical information in ways that enable meaning-based retrieval. The information that SNOMED CT captures includes items such as diagnoses, procedures, signs, symptoms, and cause of injury. SNOMED has a concept table that consists of more than 344,000 concepts, 450,000 medical descriptions, and 700,000 concept interrelations, each of which has a unique meaning and format definitions. The logical observation identifiers names and codes, or LOINC, is the preferred standardized terminology for laboratory data in information systems, and it provides a standard set of codes and names for the electronic reporting of laboratory results. LOINC has expanded to include observational data such as vital signs. It is also used for standardized assessments and care plans in long-term care and home health. RX norm is a clinical drug nomenclature developed by the Food and Drug Administration, the Department of Veterans Affairs, and HL7 to provide standard names for clinical drugs and administered dose forms. It is non-proprietary and provides the standards for drug ingredients and strength, as well as dose formats, drug properties, physiological effects, and therapeutic category. The Unified Medical Language System, or UMLS, was developed by the National Library of Medicine, or NLM. It is a program designed to build an automated system that can understand biomedical concepts, words, and expressions, and their interrelationships, and it includes concepts and terms from many different vocabularies. There are two key concepts of UMLS: semantics and syntax. Semantics is a branch of linguistics dealing with the study of meaning. including the ways meaning is structured in language and how changes in meanings and form occur over time. Syntax is described as the study of patterns of formation of sentences and phrases from words and the rules for the formation of grammatical sentences in a language. In other words, how words are sequenced can change the meaning of the phrase. For example, attending physician has a very different meaning than physician attending to. National Drug Codes, or NDC, were developed by the Food and Drug Administration to act as a universal, unique identifier for human drugs. The NDC identifies the labeler or vendor, product, and trade package size. The current dental terminology, or CDT, is the system used to code dental procedures such as tooth extractions, tooth implants, and so on. The CDT was developed by the American Dental Association and includes diagnostic, preventive, restorative, endodontics, periodontics, and other dental procedures. Medicine is a nomenclature and knowledge-based system. It is the most comprehensive vocabulary for signs and symptoms. Medicine includes 250,000 clinical data elements that fall into the following categories: symptoms, history, physical examination, tests, diagnoses, and therapy. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, is a classification system of behavioral and mental disorders used by a mental health provider. The current edition is known as DSM 5. The purpose of DSM 5 is to assist physicians in properly diagnosing patients with mental and behavioral conditions. The new format of ICD 10 codes was applied to DSM 5. DSM-5 provides detailed and specific criteria and information for physicians to accurately diagnose the mental disorders of the patient. The ICD-10 includes mental disorders and all other diagnoses, but it only provides a list of the diagnostic codes and does not provide the detailed information about the diagnoses. To allow for interoperability, a crosswalk between the various terminologies must be created. This crosswalk is called mapping. This is the process of associating concepts from one coding system with concepts from another coding system and defining their equivalents in accordance with a documented rationale and a given purpose. Categories such as the following can be used in mapping. One-to-one match. This is an exact match made between the systems. Narrow to broad. This is a more granular term in the starting system, maps to a more general term in the receiving system. Broad to narrow. A more general term in the starting system maps to a more granular term in the receiving system. Unmappable. There is no matching into the receiving system. A common mapping system is General Equivalence Mappings, or GEMS. GEMS were created by the Centers for Medicare and Medicaid Services, also known as CMS. GEMS are used to convert ICD-9 codes to ICD-10 or ICD-10 PCS codes, or the reverse. Because the systems are not identical, the user would have to decide which code to select. See Table 12.2 on page 211 of your textbook for an example. Messaging standards may also be called interoperability standards or data exchange standards. The purpose of messaging standards is to support communication between information systems. With messaging standards, proprietary systems are able to talk to one another, allowing the exchange of data. Standards do this by mapping proprietary forms to other formats. Existing standards have allowed for flexibility, which has caused problems with the interoperability between systems. The ANSI Accredited Standards Committee, or ASC X12 Insurance Subcommittee, develops messaging standards for electronic data interchange, or EDI. EDI is the exchange of routine business transactions from one computer or information system to another in a standard format using standard communications protocols. ASTM International develops standards for security, health record content, the continuity of care record, and the exchange of laboratory data. Examples of messaging standards include Health Level 7, or HL7, Digital Imaging and Communications in Medicine, or DICOM, and the National Council for Prescription Drug Programs, or NCPDP. The Digital Imaging and Communications in Medicine, or DICOM, standard retrieves images and other information from imaging equipment of a variety of different vendors. Areas covered by this standard include message exchange, data dictionary, data structure, and encoding. Although DICOM started out in the diagnostic medical imaging area, it has broadened to include specialties such as cardiology, dentistry, and radiology. The ANSI Accredited Standards Committee X12N, or ASC X12N, is responsible for developing the EDI, or Electronic Data Interchange standards, used to share information needed for health insurance administrative transactions, like your claim forms. These include functions such as benefit enrollment and maintenance and healthcare claim payments and advice. The National Council for Prescription Drug Programs, or NCPDP, is an independent SDO and is ANSI accredited. These standards were developed for and used by retail pharmacies and payers for claims, eligibility, and remittance advice. These e-prescription standards, called script, control data to be shared for new prescriptions, refills, and other communications between physicians and pharmacies.